Hi, I'm Dr. Reed, and I'm the Medical Director here at Nani Aesthetic Medicine. I'd like to welcome you all here to our first beauty event of the year. It's called New Year, a Beautiful You RHA Virtual Event. Thank you to all who registered. Your participation means a lot to us. Today we have something fun and interesting for you. You will be able to watch actual filler treatment, how we use the RHA filler in different areas of the face. I encourage you to stay until the end for a live question and answer segment. You can submit your questions via the question tab and it'll be answered live by Marie, our aesthetic injector. Also, those who stay until the end will be entered to our New Year Makeover giveaway valued at $1,700. One lucky participant will win 1 syringe of RHA filler, 1 laser treatment, and 1 facial. We'll contact the winner by email. We'll also be having an RHA filler special exclusive pricing to you. It'll be valid for 48 hours. It will run from today, January 31st, to February 2nd. The pricing will be posted at the end of the presentation, and it will also be emailed to you. So take advantage of it because it is the best pricing we have ever done for the RHA filler. If you've been thinking about getting fillers but you didn't know where to start, watch our presentation and then book a consultation.
Fillers is actually one of our top treatments here at the Nani, and like I said, it just grew significantly, really, because our approach here at Nani is really all about natural looking results. And you can see that in our Instagram and our website, all the before and after. We don't overfill our patients, and that's basically the whole point why we got RHA, resilient hyaluronic acid. It's because of its natural looking results.
It's also one of the, I guess, the top or the most popular filler in Europe.
Yes.
And it's only more recently become available in the United States. And so, you know, we're really happy to be able to offer this to our patients now. And we found that the results that we get from it are very good.
Yes,
Yeah.
And I can attest to that because we've been using it since we launched it sometime August last year, and all the ones that you see, the before and after photos that you see on Instagram, majority of those are really with RHA. And the good thing about this filler is it lasts long, based on clinical studies, up to 15 months, give or take. And then also you have different variants ranging from the thinnest RHA2 to the thickest RHA4, which allows me to customize the filler depending on the patient and depending on the area of the face.
So Marie, you mentioned the different grades of filler, and I understand that the thinnest one hasn't been approved yet here in the United States, but we've got the grade 2, the grade 3, and the grade 4, and based on their thickness, you determine where and how to use them. Can you maybe explain a little bit more about that, how you make that decision?
Okay, sure. So I use RHA2 for nasolabial folds, but case to case. Anything that requires minimal correction, say for example, superficial lines around the mouth, or we call the perioral lines. I can also use that for the lips, which I already tried for some of my patients, for those that are just needing hydration and very natural looking lip filler. I use that too. Now RHA3 is between the 2 and the 4. It comes to stretchability and also the thickness. I like to use it, again, case to case, for cheeks, nasolabial fold, and also the pre-auricular if there's volume deficiency there. My favorite is the RHA4 because that one I can use to create contour for the cheeks, the jawline, and the chin. And I find that it is not as stiff as the other fillers that I have tried for my patients. And then when you smile, it looks natural. And one thing that I like about the RHA line too is the depth of injection. I can go subcutaneous, superficial, and I can go deep with the RHA4, and the results are phenomenal.
That's great. And one thing that interests me is the fact that it lasts quite a lot longer than the traditional fillers that have been used in the past. They generally are about a year, aren't they?
Yes.
And yet this lasts quite a lot longer than a year.
Yeah, up to 15 months based on clinical studies. So that's one advantage, more bang for your buck. And then, of course, like us, we have high patient retention. So I'm really able to monitor the progress of my patients for the first time that I did fillers on them. And then second, third month, fourth month, fifth month, it's really looking very natural. It's not bulky, it's not lumpy. It's just very natural.
That's good.
Tell me about your concerns for today.
Oh yeah, so I'm concerned about this area here.
Okay.
And then down here.
All right.
Yeah, so I'm just wondering, and I guess some volume loss here too.
All right. Well, you know what you want. Very straightforward. Yeah, so our beautiful patient here, obviously, she doesn't require a lot of corrections, but she's of age. We see some loss of volume already. It's pretty much common for, for our age group, 40 and above, right? You're in the 40s already, right? Okay, so when I assess a patient, just know that I am not critiquing. I'm just assessing so that I can give the optimal results and realistic expectations. So when I look at your face, you actually still got good medial cheek fat. Wow, thanks to genes, right? But you pointed it out. I can see some volume loss, pre-auricular, okay? That is more or less contributing to the jowling that's happening downward here. So my plan of action for you, feel the volume loss here, and then relax face for me, and you have a little bit of nasolabial, what we call smile lines. We can also soften that, and then we can also kind of give the jawline a little bit of definition, and you have little wrinkling, dimpling here on the chin. I will smooth it out, and then also lessen this shadow that I can see from this side. It's a pre-jowl, yeah? So when I treat the jowl, the pre-jowl is part of the treatment plan. Now I use the different variants of RHA depending on the area of the face. So it varies. So say for example, for the contour, for the jawline and the chin, I use RHA4 because it's the thicker. When I say lift, okay, it's not gonna replace what a true facelift is doing. It's creating an illusion. But I like the RHA4 when I'm creating contour, defining the high points of the cheeks. But in your case, you're still good. So I'm going to concentrate on the jawline and the chin for that. Now for your nasolabial fold, they're not as deep. I'm just going to minimize the appearance of the little lines that you see with RHA2. RHA2 stretches more and it's thinner. So it's ideal for that. Again, case to case. It varies patient per patient. And then RHA3, which has the medium thickness, is mostly I use it for the pre-auricular. And it's going to give the overall cohesivity that we like to see for patients. I always do the full face rejuvenation, especially for patients of certain age, so that we can get optimal results. But I want it natural looking. That's why we like the RHA, because it is good. I mean, in terms of that natural looking results that you want. Of course, it's also injector dependent. It's not just product dependent. It's how you inject, right? And who's doing the procedure. My approach here at Nani is just to make you look like you had a good night's sleep. No one would know what has been done, but you appreciate yourself. Oh yeah, look, yeah, I know what she's saying, and look a little bit more rested. And the jowling here is minimal, because I don't want to overfill my patients, because when you overfill, that's when you look freakish. We don't like that. We want to maintain the natural anatomy, and when you respect the facial anatomy, then we get the results that we like. Okay? So, are you ready?
Yes.
So, I always mark for guidance. This will give me, I would say, the canvas that I like to work on. Okay? But of course, as with any artist, sometimes I deviate depending on still what I see. Okay? But this is my starting point. Alright, so the first thing is just to inject lidocaine. This is actually, a well-tolerated procedure, but I want it more comfortable for my patient. That's why I inject lidocaine. Okay, I'm gonna start with her periauricular. This actually is my technique, especially when we're doing the jowls. Little pressure, okay? Anytime uncomfortable, you gotta let me know. So far, so good.
Yes.
Now you will feel this little pressure. All right, I'm in little pressure, okay? This one, like I said, this is RHA 3, medium thickness, and I find that this is very good for this area when it comes to filling the volume deficiency here. You're doing okay? Nothing crazy? Okay. So I'm just slowly filling in. I'm doing threads. Does it feel weird?
No, just pressure.
Just pressure, no pain. Level of 1 to 10, 10 being the most uncomfortable or painful. How do you rate it?
Like a 2.
2.
Yeah.
It's good. So we're done with the preauricular. We've already seen some improvement in her issue of jowling. So this time around, I'm gonna work on her jawline. And RHA 4 is the filler that I choose for this area, because as mentioned, this is good for contouring, for defining. And so when you will do this, do like that. Nice. Clench your teeth. Clench, clench, clench. Clench hard again. Okay, so usually anterior to that is where the facial artery is, so we're trying to avoid poking that. Okay. Alrighty, so you can relax. Okay. So if you notice, I'm using a blunt tip cannula, and that is my preferred way on introducing or injecting filler, because that lowers the risk for vascular occlusion for about 77%, and also it allows me to inject larger area of the face with just single entry point. The only discomfort that I tell my patient is every time I create a port of entry using needle, but that's about it. You saw earlier that I only, there's only one injection point, and we were able to fill the area without having you do multiple needle pokes. The less needle poke, the less swelling and the less bruising. So that is our approach. There you go. All right, we're in. Little pressure again. You're okay? So I am starting with the posterior jawline, and this will help minimize again, in combination with the periauricular and the pre-gel sulcus that I will address later. This will help with minimizing the appearance of her jowls. Okay, No pain.
No.
Perfect. The approach is always start lateral so that we don't overfill in front, yeah? So again, just slowly filling this area and giving her a nice contour here. Now we're done with the preauricular, the jawline. I'm gonna address now that very little nasolabial or smile lines that she has, and the perfect product for that to use is the RHA 2. I don't directly feel the folds, but I go around it. I fan and deposit little filler.
So Marie's finishing this side of the chin now with some filler. And which grade are you using for that, Marie?
This is RHA 4.
So this is RHA 4. So we have, as you know, we have different grades for different parts of the face.
So we're done with the full face rejuvenation. Now my final thing to do is just massage the area, and I use a topical antibiotic just because we created holes in her face, right? So it's kind of like a prophylaxis too. So to sum it up, we address the pre-jowl by addressing the pre-auricular. She's also concerned with the nasolabial. I gave her a very nice jawline. There's a little bit of swelling, and I minimize the pre-jowls. The cherry on top is the chin. Smile for me. Oh, smooth. Oh, smooth everything. Whoa, it's all worth the pokes. Ready for the reveal?
Yes.
Okay, there you go. Oh.
Wow.
You see your chin,
Yeah.
your jawline when you smile.
Yeah.
And then when you smile, you don't have like wrinkles here anymore.
Oh yeah.
You concern your nasolabial. Relax. So in relax that much, smile. So it's still, you know, we retain the natural dynamics of your face. And then turn to this side. You see this jaw.
Yeah.
Whoa!
Yes. Yeah.
And you're so good. You're so contoured. Oh my God, love it.
Cool. Thank
Okay,
you.
all right. All right.
On behalf of Ali Nani Aesthetic Medicine, I'd like to thank all of you who registered and watched our virtual event. We will check the names of those who have attended and we'll draw the winner from the list. We will contact you by email and phone call. Also, please check your text messages after the event and reply back with yes to book a consultation. We will stay online for the next 15 to 20 minutes so you can ask questions. The following prices are going to be valid for the next 48 hours. 2 fillers for $150 discount off of our regular price. 3 fillers, $275 discounted from regular. 4 fillers, you get $450 discounted from our regular price. And if you go with 5 fillers, you get $850 discounted off of our regular price.
Hello, everyone. Thank you so much for attending. Hello, hello, hello. I hope you enjoyed our virtual beauty event. To those who don't know me, I am Nurse Marie and I am the aesthetic injector at Nani Aesthetic Medicine. So we have a few questions here ready. I invite you to ask questions. There is that question mark at the bottom of your screen, and I'll be reading them one by one, okay? So first question is, how much is it per syringe? So always, this is always a question, yeah? So right now we have special pricing at Alina, especially if we do full face rejuvenation. My approach here at Ali Inani is not just tackle one area, especially if you're a woman of a certain age, like myself, I'm 47. So it requires some correction. Therefore, the number of syringe really varies per patient, okay? And also, it is different per filler that I use. But for the most part, it is, okay. But for the most part, just to start off for RHA, one syringe of RHA is $850. That's why for this event, you have a special pricing. Okay, so that's the first question. At most times for my first time patient, I like you to come in for a consultation so that I can create a treatment plan for you. Take note that one syringe is only 1/5 of a teaspoon, so it's really not a lot. So therefore, my approach is to get you on board, explain to you, and also be able to address realistic expectations for the most part, okay? So next question is there any downtime after fillers? Okay, what are the precautions? Downtime with fillers, as with anything, although you've seen me use a cannula, just expect there's a little bit of swelling. There might be bruising. The reason that I use cannula, as I explained in the video, is because it reduces the amount of swelling and bruising. So, but ideally, if you're gonna attend an event, I say don't do any kind of injectables at least 2 weeks before. But in my ideal setup, I tell my patients, if you're gonna have a huge event, do it 1 month before the big event so that we can allow the fillers to settle in. And also, you know what, if we need tweaking, then that's the perfect time for you to at least evaluate, okay? Next question, what does it feel like? Does it hurt? There is very minimal discomfort. That's why, again, I go back again to my preferred way of injecting, which is cannula. For the most part, the discomfort there is when I inject lidocaine, which stings. But lidocaine helps everyone feel comfortable about the procedure. There's a little pressure, but for the most part, no one has walked out yet during the filler injection, okay? How much is the consultation? So all consultation has a non-refundable $50. Okay, this $50 goes towards your treatment or the products that you purchase on the day of your appointment. Can I work out before and after getting filler? No, okay? So usually I tell my patients, you have to schedule your filler wherein you're just gonna rest for that day, especially if it's your first time. So no exercise 24 hours after the treatment. Good question. Is it safe to get fillers after COVID vaccination or boosters? You just wait 6 weeks, yeah? There is very, very, very limited, I would say, isolated cases of patients who reacted to the vaccination after their fillers, and mainly because both triggers inflammatory response. So just to be on the safe side, I'd suggest you wait 6 weeks before getting a filler. Next question, how long does it last? Each filler has their own rheology or the properties. But for this particular filler, clinical studies say that it can last up to 15 months. Who are the exclusive providers of RHA on the website? We're the only one, yes. We're actually one of the very first practices, not just in Oahu, but in Hawaii, to bring RHA here just because we always want to give the best to our patients. We're always up to date with advanced technology. And then as soon as I saw a lot of mainland doctors talking about RHA, I said, and I told Dr. Reed, we got to bring this brand of filler to Ali'inani. Can I do facial, Botox, and fillers all at the same day? Yes, you can. But in this order of treatment, you do your facial first, and then you're going to do the fillers with me, and I finish Botox, okay? The only thing is there should be no facial 1 month after I fill your face. Anything that's potentially going to distort or affect the area of injection that I created. I tell my patient, no facial until you see me in your follow-up. Okay, and then other more questions here. We have a lot of questions here. What is the difference between RHA and the regular dermal filler? Very good question. So RHA is the only FDA-approved filler for dynamic folds in the face. And also because RHA is the only filler that is actually the only filler to date that is the least modified. And when you say least modified, the hyaluronic acid is very close to our own body's hyaluronic acid. It's so close. And I have RHA on my cheeks and my posterior jawline. And I can smile, talk to you, and it just goes with my expression. It looks natural. So that's the big advantage of RHA versus regular dermal fillers, especially that I've been injecting RHA and other fillers for quite some time already. So I know the difference, not just for me, but also for my patients. What does it, okay, I think is it dissolvable? Yes. So that's the great thing about RHA because it's HA, hyaluronic acid. You don't like the effect, then we can resolve it by dissolving the filler. Okay, I think I've answered this, the difference between all the different fillers, Restylane, RHA. RHA is actually the newest filler, but it's been around, especially in Europe, for quite some time already. And interestingly, the founder of Juvederm, or the one who created Juvederm 20 years ago, is the same creator of RHA. And the reason being that, I'm not sure if I'm pronouncing her name right because she's French, okay? Madame Topin. The reason being is she would like a filler that closely resembles the body's own HA, hyaluronic acid. Okay, how many syringes do you use in your model? I use 5 syringes for her. 5 syringes is equivalent to 1 teaspoon, just for reference, because 1 filler is equivalent to 1/5 of the teaspoon. So it's really not a lot. Remember, it's the injector that makes a difference. And my approach with it, Nani, is if I look natural to you and you like what you see, then it's the same approach that I give to my patients, okay? If I have an event, how far in advance? I think I've answered that. Next question, can you do temples? Yes, we can do temples, but that is a high-risk area, and you have to make sure that the injector that is doing the temples is an advanced injector because, like I said, it's a high-risk area, and that's something that needs to be respected, okay? Wow, thank you for all these beautiful, wonderful questions. I've heard that RHA is now the leading filler in Europe. In Europe, yes, you are right. It's the #1 filler in Europe. And that's why we like to have it here at Ali'inani. Can you go over the event specials again? Actually, this is a very good question because I would like to add to the event specials. The first 10 to actually book an appointment and get 3 syringes will get 1 free syringe. So it's an $850 value, free value for you. So that's just for the first 10 patients, okay? Now for the rest who are still deciding, 2 fillers at $150 off. For 3 fillers, $275 off. And then for 4 syringes, you enjoy $480 off, and 5 fillers, $850 off. So once we're done with this event, you reply to the text so that we can get you in for consultation, and we'll be able to actually work on a treatment plan for you, okay? Can I sleep on my face after fillers? No. Okay. So this is one of the no. Preserve what has been created. So for the first 2 nights, I actually tell my patients, you sleep prop pillows and do not squeeze your face. You got to protect the investment. Okay. If I purchase now, is it okay to use in April? So a few months out. Yes, you can. You can purchase ahead of time, and then we can schedule you later. Just wanted to say aloha. Aloha! Thank you for watching. Okay. 3 more questions. Is this filler recommended for suborbital area? Yeah, so we can use, and I can use RHA too, given that the patient is the right candidate for it. Not everyone is a good candidate for that. So it requires consultation, and depending on the problem area, or you got a lot of volume deficiency there, then I could actually either choose among the fillers of RHA. RHA 2 is the most ideal for that area. But again, it boils down to patient per patient consultation. Do I need to stop anything prior to getting fillers, supplements? Oh, yes, of course. Remember, we use needle regardless, yeah? I create a port of entry. So what I tell my patient, and this is pretty much common, not just for filler, because a lot of times when patients come in, they come not just for fillers. I also do their Botox. So a lot of needle points there, right? So if you're taking aspirin, stop that unless it's contraindicated by your doctor. Vitamin E, fish oil, anything that thins out the blood, ideally stop that. And of course, do not drink the night before. That's always what patient does. When I inject and I see right away there's blood, remember, every time there's bleeding, bruising can happen. So just to avoid the bruising, I suggest don't drink the night before, and avoid blood thinners or ibuprofen and the things that I've mentioned earlier. As Botox is not as effective on me, would it help around the area to reduce wrinkles? Actually, I combine treatments, especially around the eye area. When you smile, okay, sometimes you have lines that run past across the usual area of treatment, and that's mainly because there is volume deficiency there. Yes, we can use RHA filler in that area so that it supports, especially if the concern is no longer wrinkles but loss of volume. What can I do to minimize bruising? I think I've answered that already. In case you bruise, what can you do? Ice pack or arnica. So those are the only things that I can tell you. And eat lots of vegetables, drink lots of water, eat fruits to accelerate healing. Good question. At what age do you recommend that we start using fillers? Well, I don't want you to start using filler if you're under 18 years old, okay? But for the most part, majority of my patients belongs to 40 years old and above. I believe because they can relate to me, that being that I am a Gen X, okay? But if you see some volume loss already, or for some women that they like their lips, then they can start getting their lips in check if that's something they like to do, right? So age is relative. If it bothers you, then come see me for a consultation, and we can design a treatment plan for you. Do we have any more questions? And by the way, just to give you an idea how much RHA fillers that I already used, I started collecting this before the holidays. So this is a lot of faces that I got injected already with RHA. So in terms of experience with this filler, I have a lot of experience, yeah. So I just brought it with me so that you have an idea how comfortable I am and the patient's results, especially if you visit our website and Instagram, you will see a lot of before and after. Very natural looking results using RHA. Would you recommend this treatment for the neck as well? If the issue is laxity, then fillers are not the answer for that. But if you have some necklines, for example, that you want to minimize, yes, we can address that with RHA. And my preferred filler for that would be the RHA 2 because it's very thin and it can actually minimize the appearance of your necklines. Is this good for lip lines? Yes, I've already used this many times. I've used this on the lips, lip lines, necklines, and it's just a matter of the injector using what filler is the best for the patient, depending again on the problem area. Is this good for the nose? Well, I'll tell you what, I do not inject the nose. Okay, a lot of times I tell my patients, if you're gonna do rhinoplasty, do the surgery instead. Only because you're gonna get more bang for your buck if you really opt for surgery. And one other thing that I want my patients to realize is that the nose area is actually dangerous. Well, all of this are high risk area, but especially the nose area. That's why I don't inject that because the nasal artery is communicating directly to our ophthalmic artery. So I'm all about patient safety first. I don't want to push treatment for my patients if we're going to compromise patient safety because above everything else, we can make it look fabulous. But if we're going to compromise safety, then that's not a procedure that I would like to do for you. Okay, do you have any more questions? I don't want to miss out on anything. All right. One, okay. All right. I think I've covered every, okay, there's another question. One question. All right, so thank you all, mahalo for watching, and to everyone who attended. Like I mentioned, there'll be special pricing for you, and then for the giveaway, we will contact the winner as soon as we have a tally of all those participated for today. And reminder, you're gonna get a text immediately after this virtual event, and all you gotta do is just say yes to that so that we can get you in for a consultation. And if you have any more concerns, you can always call the clinic, 693-9930. You can book online. It's so convenient, aliinani.com. And I will see you at Ali Inani Aesthetic Medicine. Mahalo for watching. Bye-bye.